This is Veterinary Vertex, a podcast of the AVMA journals. In this episode, we chat about the June JAVMA supplemental issue, Diagnostic Laboratory Medicine, from sampling to test interpretation, with our guest, Kelli Maddock.
Welcome, everyone. I'm Editor-in-Chief Lisa Fortier, and with co-host Sarah Wright. Kelli, thank you so much for being with us here today from my home state of North Dakota.
Thanks for having me. Excited to be here.
All right, let's dive right in. So, Kelli, you're the guest editor for the JAVMA supplemental issue, Diagnostic Laboratory Medicine, from sampling to test interpretation. What can our readers expect to take away from these articles?
Yeah, I'm so excited to share this special issue. There are some really great things. I have a suspicion that a lot of people, maybe especially working veterinarians, don't have a lot of interaction with their diagnostic laboratories, especially if they're working with big commercial laboratories. But the information contained in here, there's some original research, of course, and then some reviews. And the reviews, I think, are really helpful for just reminding folks of some really good tips to get the best test results. Because we always make the assumption of, I give you a sample, and no matter what, that quality of that sample is going to get me the same test result. You know, it maybe rolled around in your pickup for a week compared to like fresh off the animal delivered to the lab the same day. There's a huge difference, and you can actually miss getting an important test result because that sample's degraded. So a lot of those reviews are really touching on those things that'll make sure that you get that really great sample, and some things you could potentially miss if you aren't getting the sample at the right time, the right patient, right site, or providing that relevant clinical history. So a lot of things that I think the reviews and the original research touch on are that collaboration and partnership between the laboratory and the clinicians. So a lot of that. The original research, I think, is really useful. It's data coming out of the laboratories and using some evidence-based information supporting either collection requirements or extra tests that might be necessary for a veterinarian to consider.
Yeah, thank you for stepping up to do this, Kelli. Like I was in academia for 35 plus years, and even though our diagnostic lab is half a few steps away, it's still really important that people know how to submit these samples. Synovial fluid was the bane of my existence for the longest time. Like, please stop putting that in a portacult. Please stop doing that and putting it in the refrigerator. So I really, really deeply appreciate you stepping up and taking on this challenge of making diagnostic laboratory into a full supplemental issue. It's going to be super important.
Really appreciate that opportunity to do so, because anytime we can get laboratory information out and remind folks that we exist and we want to talk to you and we want to help you get the best results, it's a great opportunity. So thank you.
Yeah. What sparked your interest in diagnostic laboratory medicine?
Journey was kind of windy to the field. I had started out, I was trained in human medicine, loved microbiology, and so that was kind of my home, but I ended up getting burnt out at the hospital, a lot of hours and shifts. Always loved helping, but also didn't necessarily want to be in front of patients all the time. So laboratory medicine, it was a very appealing way to be able to contribute those skills and love for science. And I wound up at the vet lab because of Dr. Claire Burbick she was at NDSU while I was a med tech, and we took training together, and she ended up recruiting me, and I haven't looked back. I've almost been in vet med for 10 years now, which is more than I'd been in human med. So it's been a good shift, and I'm so proud of the diagnostic lab medicine field and what we can do, and just love being able to interface with folks and talk about what we do.
Well, we're fortunate to have you in vet med.
Thank you.
Every time we write an article, and especially when you put together a supplemental issue, I certainly learned a bunch reading all these articles. What did you learn, and what was surprising to you when you read this collection of articles that you had curated?
I absolutely loved that a recurring theme throughout the articles was just communication with the laboratory. Regardless of the discipline, we have information from pathologists, toxicologists, coagulopathy, several microbiology articles, but a lot of that just came down to good sample and communication, and just really thinking about the whole picture holistically and just having a good open dialogue with the lab. And that all just kind of organically came together. And I would say that's probably one of the biggest challenges we have in the lab. And I'm sure clinicians too, you're busy, you're out in the field. I know rural North Dakota, there they're in a truck, middle of nowhere, maybe gonna have spotty cell phone reception, and they're trying to call the lab and ask about a result, or what do I collect, or hey, I might have an anthrax. Can you help me out? So, I mean, just that communication and connection with the lab is so important, and that was a nice recurring theme.
I really like what you said, that it's dialogue. A lot of times, people can perceive that laboratory, clinical support, necropsy, those sorts of things are just supporting infrastructures. But for me at least, when I would call the diagnostic lab and ask a question, especially ClinPath, they would say, "Did you think about this? Because I've seen a couple other cases, and you might not have seen it, but as the clinician, but as the diagnostic laboratory person." So I really like that word, that it's not just one informing the other, or one relying on the other for a service. It is truly a bilateral dialogue.
Definitely. And there are just so many little things that can help spark additional information. As a microbiologist, some of your keywords in your history is going to make me choose different culture media that might get a bacterium to grow that wouldn't normally. And that's very true of pathologists, even molecular. We might call you and say, would you like to add this test on? That might be a little more complete. So it is really helpful. And that's not just our little lab in North Dakota making time to chat with our clients because we're little. Most diagnostic labs, I think, would be really happy to talk to their clients and help get that richer test result for the clinician.
I think that's one of my biggest takeaways from my diagnostic medicine rotations was don't neglect the history. Don't just put a wine line history, like give them the details they're going to need to help you, because ultimately you're going to have a better outcome, hopefully, for your patient, a more holistic clinical picture too.
For sure. And more than just, I gave you money, here's a test result that might say mixed bacterial growth, but you call me and I might be able to tell you, like, maybe it would benefit from collecting a little bit more aseptically, or it's telling me it's normal, so maybe consider viral, some of those different things. It's, yeah, very helpful.
And for those of you just joining us, we're discussing the JAVMA Diagnostic Laboratory Medicine supplemental issue with our guest, Kelli Maddock. So, Kelli, what are the next steps for research in diagnostic laboratory medicine?
I think continual investigation into how veterinarians are using laboratory results, and then what they either perceive that they're getting and using in clinical practice, um, versus what we're trying to give them. So Diaz Campos et al. Had done a paper for this special issue on how veterinarians interpreted antimicrobial susceptibility test reports. And this is something we get all the time in the lab: is you only gave me 5 drugs. This other lab gives me 20. And so she investigated, did people have sufficient information to make clinical decisions based on a smaller report with more comments, or did they prefer a longer laundry list of drugs? And ended up finding that when the laboratory took more time to have more tailored results, that veterinarians made better treatment decisions that also supported antimicrobial stewardship. So there is a lot of evidence that the way that we put our reports together and the information we put out, it does actually inform clinical decision making, and hopefully helps you make better decisions without you having to be the expert and sort through each of the drugs on the list and make the best choice. You're busy. You're trying to make these decisions quickly between patients, and a good lab report should help you do that quickly. Should have sufficient information to let you know what potential limitations are. So yeah, I think there's a lot more that can be done that way, not just in microbiology, but in other areas of the field. And then potentially looking at different analytes. There's so many things that I think could be replicated from human medicine, and just investigating how that actually translates to vet med, and just seeing what is actually going to translate and how can we make it better and make it work for our veterinarians.
Now, you teed up my next question perfectly. Uh, y- so you're clearly documenting, demonstrating a role for non-veterinarians in veterinary diagnostic medicine. If for the listeners who might be microbiologists or veterinary students or veterinarians considering a career in diagnostic laboratory medicine, what advice do you have for them?
Yeah, I would say just getting that experience and just seeing what you like, because even if you don't necessarily want to be in the laboratory, it is really important to know what we're doing. Our laboratory hosts a lot of students as student help or interns. And the one thing I always try to emphasize, if you take one thing out of here, is just know that your laboratory likes to talk to you, and they want to talk to you. They'd much rather have you call and take a couple minutes to get the right sample rather than them have to call you and say, I'm sorry, it's the wrong one. It breaks our heart to not be able to help you and to have a substandard sample. We don't want that. But for people considering a career in lab medicine, it is a really great way to be able to help people and animals, of course, without actually necessarily interacting with them. And it is still a really fulfilling career path, always something changing. It is really dynamic. We always assume culture is the same as it was 40 years ago. It is very much not. If your laboratory is keeping up with modern practices, it is not the same as it was however many years ago. There are some tried and true methods that will never change, but there's always things that can be optimized. And I see that all the time in lab medicine. In the 15 years I've been in the field, I'm still blown away by all the changes and things that I never thought would happen in my time. So it's a really great dynamic field and a really good option. And I know our laboratory has hosted veterinarians that just wanted to come through and tour. So that'd be something to reach out if you have a local lab and just see. You might end up finding out that you have interest in lab medicine, and maybe it would be a career shift for you if you're maybe getting burnt out in the clinical practice. Not that I want to poach any more veterinarians from there, but it is a really great option. And like in our lab, we are having to get more creative. We've got to get people to want to come to North Dakota, and we've got to fill roles. We're looking at starting a toxicology residency. We've had to raise our own pathologists. So there are a lot of opportunities within laboratories for veterinarians and non-veterinarians alike.
Yeah, I love our field. I love how diverse the career paths are, and you can do so much. I feel like a lot of people go into small medicine. They think they're going to anyways, and they start vet school. Then you come out and your eyes are just open to all the different possibilities. So very, very
So
cool.
many different things you can dabble in and get into. I had no idea vet med in microbiology was going to be something I'd get into, and it's perfect.
Now, Kelli, as you know, is a repeat guest on our podcast. This next set of questions is going to be super important for our listeners. So, out of all the amazing articles in this supplemental issue, what is one piece of information the veterinarian should know about diagnostic laboratory medicine in this issue?
Yeah, I think I beat this pretty hard, but we want to talk to you, and it is really great if you can call and interact and just call ahead before you're getting that sample. And I would also, as frustrating as it can be to have someone tell you you've got to recollect a sample, take that as just a learning experience and know that it's because they want you to get the best sample, the best result. There is a reason behind the madness in or in laboratory medicine. We aren't just trying to make your lives harder. We do want to help. And I think that shows through in every article in this supplemental issue.
I think we've said this before, but garbage in, garbage out. So, sounds like
Yes,
you're
that
saying
is
the
one of my
same thing.
favorite ways. And actually, one of the microbiology papers does, I believe, say specifically garbage in, garbage out. There's really great printable sample sheets that you can use to help you collect good microbiology samples too.
Awesome. Great. And then on the other side of the relationship, what's one thing that clients should know about this topic?
Yeah, and I think this can be really challenging. I had an email even just last week with a client frustrated that their veterinarian had asked for a culture and we got a no growth. And so I explained to them that no growth is still supporting whatever your veterinarian is trying to rule out with a diagnosis. So understanding that there is a lot of value in paying that extra money for a laboratory test, whether it's they're asking you to do a culture once you think you have a UTI, there could be other issues that are causing the animal to have urinary symptoms. So really considering that diagnostics can be worth the money. It isn't just a money grab. There is value for it. It's just understanding the context and looking for those results.
Fantastic. You also know, Kelli, as we wind down, we like to ask a personal question. And before I do that, I'm hoping to meet Kelli in 3D when I go back for a nephew's wedding in July. So hopefully we can have a coffee together and exchange some great horror stories.
Yeah, that would be great.
Yeah, I'm looking forward to it. So Kelli, and if you have it with you, please feel free to show it. What is the oldest or the most interesting item on your desk or in your desk drawer?
Okay, so these have followed me since I finished my internship, but our fantastic microbiologist handmade little clay bacteria. It's a little bit to help us remember things, but also just being silly. They put it on culture loops and gave it like a bouquet of flowers. but a little ring of Streptococcus, just reminding us Strep pyogenes. She always personified bacteria, which would really help you remember things. I've got a little staff. Some people would get Campylobacter, which she always described as Farrah Fawcett, and with its flagella, it was whipping its hair around. So these are on my desk. I always think of Carol when I see them. They always make me happy.
Anthropomorphizing bacterium. That's a new one for me.
Yeah, well, it's something pretty normal for us microbiologists. So
Good
yeah,
party trick.
yep,
Unique microbiology seems so fun. I love that.
it is super fun. There's no question about it.
Awesome. Well, thank you so much, Kelli. We appreciate you being the guest editor for this supplemental issue and for also sharing with our listeners some insight into what they can expect to gain from the articles.
Awesome. So excited for everyone to check it out. There's a lot of really great information inside.
And to our listeners, you can read the Diagnostic Laboratory Medicine supplemental issue in JAVMA. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.